Good afternoon, guests, and welcome to the Weekly with Dr. Tom. This is your way to stay up to date with everything healthcare related across the country. In this educational virtual group, we'll explore how best to manage diabetes in isolation, what it's like living with diabetes in isolation, and other related topics. There will be a Q&A session at the end of the seminar. Submit your questions throughout by using the Q&A button at the bottom of your screen. We'd love to hear about how COVID and social distancing is affecting your life. We hope you enjoy the session. Now, here is Dr. Tom.
Thank you, Tristan. Welcome guests to the third episode of the Weekly. We're privileged today to have an eminent guest, Dr. Tony Chow. Tony is an expert in infectious diseases. I don't know how many pandemics he's lived through, but he's about to tell us. I've known Tony for more than 30 years. In fact, he was one of my first profs when I was doing my residency at Vancouver General Hospital in the late 80s. Tony was famous for being a great teacher and for running very long rounds. We often didn't get home until well after dinner time. Tony, welcome as our guest on the Weekly.
Thank you, Tom, for that introduction. I have to say I'm so glad that I taught my students well, because I depend on my former students for my healthcare nowadays, very much so, in so many aspects. Anyway, again, thank you for inviting me. I just have a few slides to share before we go on to a question-answer session. So let me just put on the slide here. Okay, so here. So Tom has already shown a little bit about the curve, the current situation. I just wanted to emphasize just to say how lucky we are in Canada. This is a graph, is the most current data showing the cumulative number of cases of COVID-19 globally. And we're over here, and you can see Canada is way down here compared to our neighbor south of the border, which is really horrendous. And at this point in time, it seemed like Italy, Spain, and Germany are leveling out a little bit. This is a blown up showing where we are in Canada. South Korea is down here, and United States over there. Now, it does appear that we are over the peak, and that it is flattening a little bit. This, again, is the number of new cases, lab confirmed, and this is in BC. And you can see the first cases, the sporadic cases shown earlier in January, February, and then the outbreak really starts to take off. And you can see March 17 is when our public health decided that it should be to enforce physical distancing and limiting number of gatherings, less than 50, people banned, schools closed. And you can see the effect of that. And so that it really started to come down. So this physical distancing, I rather like the term physical distancing as opposed to social distancing, because we still need to socialize even with this outbreak. But it looks promising. However, we need to remind ourselves that these symptoms, these are based on onset of symptoms, and symptoms lag behind by the real onset of disease by at least 5 days to a week. So we definitely need to continue to be vigilant in terms of physical distancing, washing our hands, not touching our face. And my best guess is that we may have to do that, up until maybe even into May or July, because we don't have effective treatments. Or even, and the best way of prevention is right now the good hygiene, physical distancing, and washing hands. And so really cannot emphasize that enough. Now, just a few words about the virus itself. So, you know, the virus that causes COVID-19 is called coronavirus 2. So, important thing to know that these viruses, they're non-living organisms in that they can replicate by themselves outside of the body. And so, you know, ordinary antibiotics, for example, won't kill these organisms. And the only way the virus can replicate is to get into living cell of another person or what have you. And this is why the physical distancing is so important, our best means right now in terms of transmission of this viral infection. A virus actually is quite fragile. It's, you know, mainly a protein. It's got a layer of lipid fat on the surface which protects it. And it's pretty fragile, and that's why soap and water works so well. Particularly, you rub at least 20 seconds, create a foam, and that's very effective in dissolving the fat layer and causing the virus to disintegrate by itself. Similarly, any detergent will work. Alcohol, but you require at least 65%. So your ordinary vodka or whiskey will not do it because the strongest alcohol you have there is only 40%. You need at least 65%. And heat, again, over 25 degrees is good for dissolving the lipid layer. And so warm water is good. Bleach, diluted, 1 part to 5 part of water is very active. UV light is very good. And so this has been looked at as a potentially good way of disinfecting masks for reusing. And some places in the States have actually done that and seem to be very useful. Because we have to wash our hands so often, it's important to use a sanitizer with moisturizer or use moisturizer frequently to prevent skin shafting because virus particles can hide in there. On the other hand, the virus itself will not invade through intact skin, so you need broken skin, and maybe really the only places that get in is the mucous membranes in the nose and the eyes and the mouth, and that's where it gets in. And incidentally, these cells in the mucous membrane have these receptors, and that's how the virus will have to attach to the receptors and get in. So in terms of prevention or antiviral treatment, it seems like the best way is actually agents that block the virus from getting into the virus. That seems to be the most promising. But there are lots of research going on right now. The virus is pretty stable, so in terms of different surfaces, but it depends on the nature of the surface, it depends on the temperature, it depends on the humidity. And by and large, metal, glasses, ceramics, paper, wood, they last at several days, 4 to 5 days. Plastics, a little bit shorter period of time. Stainless steel, still 2 to 3 days. Cardboard, a day. Aluminum, copper, actually in terms of hours. Importantly, virus doesn't seem to spread through food, and there's no evidence for transmission. So, you know, we don't have to worry as much in terms of vegetables and fruits that we get in the groceries and eat, and is not being found in water. So I thought this might be a quick review, just sort of understand a little bit about the biology of the virus and sort of explains why we do things that we do in terms of trying to help prevent spread. So I think I'm going to stop here and then be ready for any questions.
Thanks very much, Tony. Last week, we mentioned that you were going to talk about masks. So I guess this is my chance to ask you, should we be wearing masks when we go outside of our homes?
Yeah, that's a good question. Masks, you know, it's there's a lot of debate when, in fact, when I was asked in an interview for a Chinese newspaper at the beginning, I think it was in February, I was pretty adamant to say, mask is not necessary because it's not in the community yet, and you know, you only wear it to protect others, not to protect yourself. And you protect others, particularly if you yourself is not well, sneezing or coughing or what have you. It prevents droplets from reaching others. Now, gradually, things have changed. And what has changed is, firstly, we now know that virus is in the community. There's community transmission now, so that's a huge difference. The second thing is that we also know now that some people, although what proportion we don't know, have very few symptoms, at least early on, and before they actually develop full-blown disease. And so they may still transmit the virus early on. And because of that, we really have to worry now about you know, every personal contact, and that they may actually carry the virus and potentially could transmit to you. So with that in mind, I personally changed my mind now and feel that masking is probably worthwhile. But I will still put masking, you know, below physical distancing and hand washing. Those are the most important. And then after that, you've done all that. And then if you go into crowded places, such as grocery shopping, I had to do that this morning for the first time. Wore a mask because the physical distancing may not be that easily controlled in that kind of a setting. So in that case, to use masks. The big concern, the reason public health has been discouraging, and World Health Organization been discouraging use of masks before, is the worry that that once you sanction masking, the public will hoard it, as did happen, and what we need are the masks, particularly surgical masks and the real N95 masks for our frontline workers and healthcare workers. And so CDC therefore recommends now you use a cloth mask, or use your own, but not the surgical N95 mask. And Incident Tom showed us a video by an Italian physician that made a mask with just bounty paper everybody has, staples and rubber bands. And I made one for myself, and it worked pretty well. I put 3 layers of the bounty, and it works pretty well. No, I haven't done a proper test in terms of the efficiency of filtration, but if you're in a bind, that would be something to use.
Thank you very much, Tony. BC Diabetes guests and others, you've heard it from our in-house infectious disease expert. He's wearing a 3-ply Bounty homemade mask when he goes shopping. So should you, and so will I. With Tony, with that, I think we'll go to a break where we're going to be reminded about how we should wash our hands.
Okay.
Good afternoon, everybody. Thank you for joining us on our 3rd webinar, especially when we have a distinguished guest for you today. My name is Dr. Provine Samuel. I'm an orthopedic surgeon by training, and I'm with BC Diabetes in a variety of roles, the most important of which is now being on our COVID-19 task force. Now, you might think that we're obsessing about hand washing. We're not. If your hands are safe and clean, you will not get COVID-19. And as a small explanation of why hand washing is so important and why alcohol and soap kills COVID-19, I'm just going to direct your attention to a small graph here. So that's COVID-19. COVID-19 has 3 parts. The middle is the genetic material. These pointy spike-like things that you're seeing, those are the proteins. And then the white shading is the lipid layer. And these are soap molecules. So what soap does is it attacks COVID-19, and like a crowbar, it wedges open the lipid, the fat layer, and kills the virus. The soap particles and surround the protein molecules and kill the virus. So that's why hand washing is so important. COVID-19 is a wimp. You can defeat it if you hand wash regularly and if you know how to hand wash in the proper technique. So I'm going to demonstrate for you the World Health Organization, WHO, technique for proper hand washing. There are 6 steps and the duration is 40 to 60 seconds. First, wet both your hands completely with water. Apply enough soap to cover all hand surfaces. Rub your hands together, palm to palm. Right palm over left hand dorsum with fingers interlaced. Left palm over right hand dorsum with fingers interlaced. Palm to palm with fingers interlaced. Tips and backs of fingers on opposing palm. Tips and backs of fingers on opposing palm, both hands. Rotational rubbing of left thumb in right palm. Rotational rubbing of right thumb in left palm. Rotational rubbing forwards and backwards of opposing palm, both hands. Now, rinse both your hands with water. Use a single-use dry cloth to dry your hands thoroughly. Use the same dry cloth to close the faucet. Now your hands are safe and clean. Back to you, Dr. Elliott.
So we're going to segue into the question and answer period now. Dr. Elliott, the first question is to you from Tim. What is the single most important thing a diabetic can do to stay safe against COVID-19 while in isolation?
Okay, well, if you're in isolation, you've done the single most important thing. The second one is to wash your hands. The third one's not to touch your face. The fourth one is to clean off objects that have been touched by other people who could be contaminated. And finally, look after your diabetes like you would if it weren't the COVID-19 crisis. So you're going to do due diligence, diet, exercise, test your sugar, use your CGM, adjust your medications, and stay well.
Okay, the next question is from Jennifer. Is it safe to handle fruit? And what activities can my children safely do at home or around the neighborhood?
That is a wonderful question, Jennifer. In fact, I'm going to defer that to Dr. Chow. Tony, after we've gone shopping and worn a mask and cleaned all the surfaces, what about the orange that we're about to peel? Should we be washing that with soap before we peel it?
First of all, fruits with skins, such as oranges and what have you, we don't need to. You're going to peel them off anyway, bananas, things like that. Apples, grapes, things that don't have the skin that you peel, just ordinary rinsing in water, which we normally would do anyway, it should be sufficient. You don't really need to use anything else to disinfect it. And again, there's been no suggestion of food transmission of the virus. And so I think it's quite safe just to follow ordinary practices of eating fruits and vegetables safely. Just a single regular wash, rinse will be sufficient.
Okay, well, that's a relief. And I don't know if my wife is listening in, but just rinsing the vegetables, darling, is all that Professor Chow recommends. And I've been following his advice for more than 30 years. Thank you, Tony. Back to you, Tristan.
From Michael, I'm a biology 12 teacher and I have type 1 diabetes. What lesson topic or topics would you suggest for my students to become more aware of public health, herd immunity, or other areas of importance?
Tony, I'm going to defer to you again.
Well, I think something about hygiene and and this hygiene theory, which says that it's a double-edged sword. There are people who are so afraid of germs, they want to wash everything away. You get rid of the good bacteria as well as the bad bacteria. That's no good, because time and again there are studies to show that we need to be exposed to bacteria, um, good or bad, in order to develop the proper immunity against other things. And if we don't do that, then you run the risk of other immunologic diseases. A good example is asthma. It's been shown that kids who are exposed to disinfectants, antibiotics more frequently have a higher likelihood of developing asthma later in life. And so this is an example of the so-called hygiene theory. So I think that's useful to emphasize that there are good germs and there are bad germs, that we as humans live with these microorganisms in harmony. We need them as much as they need us. And so, yes, we need to practice certain hygiene to prevent disease, but we should not do it to excess that we actually get ourselves into other issues. So I think the hygiene, the microbes that we live with, and our interrelationship with microbes, both in the environment and inside ourselves, on our skin, in our gut, in our nose, in our throat. We have lots and lots of bacteria, and if we don't have them, then we would be in trouble.
Thank you, Dr. Chow. Next question is from Karen. Dr. Elliott, I am a single mother with 2 kids at home. The government just shut down provincial parks. What are some positive activities that you would recommend we do?
Karen, that's such a key question, and we're going to have an entire webinar on how to exercise at home upcoming. My short advice is do some CrossFit exercises, go onto YouTube, find a 5 or 10 minute CrossFit and do it twice a day. That's my current recommendation.
Okay, the next one is from Lloyd. Should I expect that my blood glucose will be high if infected? In other words, could sustained high blood glucose levels be an early symptom to watch for?
That is a great question, and you are right, yes. Our blood sugar is regulated in the absence of diabetes. There's one hormone that lowers sugar, and that's insulin, and there are a number of hormones, all of which are increased by stress and illness: cortisol, growth hormone, glucagon, adrenaline, that tend to raise sugar. So if your body is stressed, whether it's from a cold, whether it's from COVID-19, whether it's from being anxious about some exams, or having had a disagreement with a friend, all of these factors will tend to raise the blood sugar. So the bottom line is do what you can to reduce the factors you know about. And of course, if you develop a fever and chills and shortness of breath, then if it's getting worse, then it's time to go to hospital. But hopefully that won't happen.
Thank you. The next question is from Adam. Is there any further information on who and why certain people are to make them more susceptible to the impact of the virus? As in, are diabetics at more risk if they are otherwise healthy?
I'm going to start to answer that question, then I'm going to ask Dr. Chow to continue. I'll stick to the diabetes topic. It's only those with uncontrolled diabetes who are at increased risk. When we say uncontrolled diabetes, we're talking about people whose A1C is above 8. If you're doing your job and I'm doing my job, I'm pretty confident your A1C is going to be under 8. That's why we want everybody to monitor their sugar closely with finger poke or with the newer CGM or flash devices. So looking after your sugar, even if your A1C was 9 2 months ago, if you've brought your sugar down to good targets, say between 5 and 7 when you wake up and less than 10 after a meal, then your sugar is in control and you are not at high risk. Tony, can I ask you to talk about other factors that may predispose?
Yeah. Generally, not just restricted to COVID-19, but for any type of infection, the general feeling is that diabetes per se does not increase the susceptibility to infection. What it does is make the consequence of infection more severe in terms of complications. And so that's one aspect. Now, in terms of COVID-19, again, in terms of why some people, I don't think they're more susceptible per se, but I suspect that people get exposed and they have a similar chance of getting the infection. Now, whether or not the patient will suffer, get severely ill, and go on to pneumonia and even die. There's increasingly the thought that it's actually due to the body's abnormal immune response, kind of like the toxic shock scenario, where the body reacts in such a violent way that in the end, it actually causes the person to go into organ dysfunction and eventually sepsis and die from the process. So that's now there. I'm sure there must be genetic factors because since we know that the virus enters the cell through specific receptors, and these receptors are regulated by the genetic control. So I'm sure genetic factors must play a role in terms of who may be more susceptible or not. It's $1 million question right now as to why, a young person without known illness, such as what happened recently in the city, a 46-year-old died suddenly in his sleep. And had very mild symptoms. It did not have all the classical symptoms of pneumonia or shortness of breath. All he had was fever, and he passed away. We await the autopsy reports to find out what exactly happened and hopefully learn some lessons from that.
Okay, so we have time for 2 more questions. Second last one here is from Mark. I understand keeping clean and all that, but why do experts keep saying not to touch your face and especially your eyes? What makes the face so susceptible?
Let me address that. I think the key thing here is that, as I mentioned before, the virus has to reach mucous membranes, such as the nose, the eyes, the mouth, for it to get into living cells. And so the reason you want to advise against touching your face is that every time you touch your face, there's a greater probability that you will end up touching parts of your eye, nose, and oral cavity and allow virus to get in. So that's why the protection is from your hand carrying virus particles to reach mucous membranes of your body, specifically those areas. And that's also why you wear eye shields. You protect yourself with mask and cover your mouth when you cough or sneeze, for all of the same reasons.
Thank you, Dr. Chow. Okay, and the last question, it's a 2-parter. Dr. Elliott, with the long weekend coming up, if there was one thing you could say to your patients, what would it be? And they also want to know if Netflix is free this weekend.
Well, I was going to say stay at home, and I'm wondering. I don't know if Netflix is free this weekend. Perhaps one of the producers can check and let our viewers know before the end of the session.
And if there was one thing you could say to your patients going into the weekend, what would it be?
It would be stay at home. I'm going to say more than one thing. It would be to just look after yourself, get back to the meditation or prayer, making sure you're calm, and looking after your general health.
Okay, at this point, we'd like to say a very special thank you to our sponsors, to you, Dr. Chow, for being our guest, and of course, to you, the audience, our beloved guests. Have a lovely long weekend. Thank you.